Oh hi, today's video. It's 11th of January already. Can you believe it? 1 minute it's Christmas week and the next minute, bang, 11th of January, 2026. Yeah, today's video is a bit of an up and down one. It's concerning the principle of what's called shared care for your medication. All right. There are several different variants of shared care, but the one I'm going to discuss is about shared care for your medication access. This applies whether you're under primary care 2, which is local mental health services, or primary care 1. Okay? I don't know the full ins and outs of it, so, you know, there's more to be looked into. But basically, what's going on with me, which is getting on my tits, is this shared care agreement. Okay, now how this works for me, might be different for yourself. Is I was under primary care 2, and then I was pushed to primary care 1. Primary care 2 is local mental health services, and primary care 1 is your GP. But at the moment, I'm in between primary care 1 and primary care 2, which is ridiculous, but there you go. I'm not going to blame anyone specifically within the service or name anybody, because the said people I've dealt with have been quite helpful. So it's not their fault directly. It's a system in place and it fails miserably. So where I'm at, the shared care aspect is actually to do with some of the medications I am on. All right, their class is controlled medication for my mental health conditions. Okay, so basically, the GP is overseeing my meds, but they've now pulled out and said, "Oh, well, we're not going to take the responsibility of a couple of medications you're on." Because, one, we didn't authorize it, yeah, and it's a controlled drug, and our policy says we don't have to supply it to you, so you need to go back to mental health services. So they're already starting this blame everybody else, don't want to take no responsibility. So basically, because some of the issues in the medications were issued by local mental health services. Bear in mind, I've had these medications for the last 3 or 4 years through my GP from local mental health services. But they've thrown their dummy out in the road and they've had a tantrum and decided, oh, we're not going to take a responsibility for your medication, so we're not going to issue them to you. So I've now had to go back to Devon Partnership Trust, Mental Health Services, and explain what's going on, that I can't get access to my medication. Oh, yes, he said, this is to do with this shared care situation. I said, well, yeah, but there's nothing I can do to change it. I'm just the victim and I have to suffer the fallout of these consequences. Yes, he said. Anyway, my GP won't issue these medications. So, local mental health services, Devon Partnership Trust, for the minute, foreseeable future, have to issue my medications per month. All right. Simply because my local GP, don't want to take responsibility. For Christ's sake, can't they work it out between themselves just to take the responsibility and get a simple job done instead of turning it into a nightmare, which is causing me more stress? So, what happens with this shared care is you're basically stuck in limbo, right? Because I'm not on shared care at the moment. But to get on shared care, there is a large backlog, a list, delays to get people on shared care. So then the GP can issue your medication. But it gets worse because it's fraught with problems, okay? Even though shared care eventually can be issued, right? That doesn't guarantee you get it, because the GP can still turn around and go, oh, we don't want to do this. Or they'll do it for a period of time and then they'll go, we're pulling out. We don't want to provide this service. You know, what's the problem? For Christ's sake, between both services, can't they work together, God forbid, and sort these problems out? All it does is cause the client additional stress. It ties up services, and ultimately it costs more money, because you can bet it's down to money. And in the meantime, I have to play their stupid game. And to be honest, I am sick to death of being pissed about by things where people are paid and there are structured departments to provide these services. And it's like they deliberately look for any way to penalise you. So that's it. Shared care is a complicated nightmare. They don't tell you how to sort it out. They don't explain how to sort it out. They just say, oh, you're not in a shared care agreement for your medication and you'll be on a list, a backlog to be processed so you can be put in a position of shared care, which means your GP can issue your medication that's being prescribed to you by local mental health services. That's until they have a tantrum and they decide, we don't want to do this and we want to opt out. So then the last scenario of that, if they opt out and they go, oh, we don't want to do that, they then use this excuse. They're pushed in the private prescription corridor where you have to pay for medication which you are entitled to have for free. So my mental health medication is basically tied up in a stupid, ridiculous situation. And then people wonder why I get so pissed off with everybody and do these videos. I do these videos because I'm telling the truth. It's what's taking place and it's my experience.